Straumann's SIRIOS portfolio, crown and pre-op workflow. Select New Crown and Bridge Case to create a new patient case. Refer to treatment plan videos to learn the details on how to complete the prescription. Select the lower pre-opera in the Additional Scans option to add one scan to your scan sequence. Click Next to start the scan. Make sure to follow the scan sequence. It can be edited in the settings. Click on the Scan button on the handpiece to start the scanner. In the Pre-op tab, scan the teeth prior to prep. Make sure to acquire all necessary data as well as 3 to 4 millimeters of gingiva. Use the same button to stop it. Lower pre-op arch scan. Use the Mode button on the handpiece to move to the next screen. Antagonist arch scan. Bite scan. Scan 3 to 4 teeth on both sides. The scanner will stop when the software has enough data. Click Next. The pre-op scan will be reloaded in the Preparation Scan screen. Mark the preparation area using the Cut tool. You can enlarge the mark cylinder by using the handle. Note that the data captured in the cut area will be processed in higher resolution. Click Cut and then the Start button on the handpiece to acquire the preparation. Tips: use different angles to acquire difficult areas. Make sure to properly dry the tooth before scanning. Click Review to process your scan and move to the review screen. You can show and hide the different scans by using the display function. Tag the tooth with the tooth tagging option. Select the tooth number in the Tooth Tagging tab and click on the top of the preparation on the scan. To draw the margin line, select the tooth number in the Tooth Tagging tab to enable the tool. You can either use dot to dot or draw margin line. The drawn margin line information will be shared with your X order. Select Validate Reduction Distance to confirm the reduced distance between the pre-op scan and the preparation scan. Click on the top of the preparation to display the distance in millimeters. Select Validate Occlusal Distance to validate the distance between opposing teeth. Place the scan file in the axis of insertion and select the Check for Undercuts tool to confirm that there's no undercut on your preparation area. The undercuts will be displayed in red. Use the Trim tool to clean your scans. Select Next to move to the export screen. Add a due date and check the prescription box. The files are auto-uploaded in Access. If you would like to place an order with your preferred laboratory, simply select Straumann Access Lab. Once exported, the Straumann Access platform will launch. Select your desired laboratory and hit Send. Reminder: the pre-op workflow is convenient when the tooth to prep is still in good shape. Use a proper retraction technique to properly acquire the margin line. The X order is a zip file that contains all your case information, scans, and attachment.